Hey, it's Eric Hartman with the CRF, again here on day one at Arvo. The conference is going really, really well, and right now we have Brazil in the house. Why don't you ladies introduce yourselves?
I am Juliana Salum, professor of ophthalmology, and I'm also a geneticist in São Paulo, Brazil.
And you?
I am Cecilia Vasconcelos. I am a psychologist, PhD in ophthalmology in Federal University of São Paulo, and my supervisor is Juliana Salom.
Excellent. So, Dr. Juliana has been a good friend of the Choroideremia Research Foundation. She sent many patients our way in order to get more information about choroideremia. And in Brazil, you were the primary doctor for the Biogen trial.
Yes,
Is that correct?
I participate in the Biogen trial, the gene therapy trial for choroideremia. We learned a lot during this trial. Unfortunately, it was not a trial that had reached the endpoint, but we learned a lot and we are ready to continue working the next trial.
Absolutely, absolutely. And your research into, you've got a presentation, is that right, tomorrow?
Yeah, I will do a presentation about a psychotherapy for people with IRD.
With inherited retinal diseases.
Exactly.
And your study looked at their mental attitudes about getting diagnosed and then also getting mobility training?
Yeah, my study is trying to be the person who has acceptance and mindfulness to deal with IRD. So I do 3 months of psychotherapy group based on acceptance and commitment therapy, 1.5 hours per session. And in these sessions, we trouble and try to do and to dialogue about the main topics of IRD in the feelings of living with IRD and the psychosocial aspects about it. So in the end, we can create coping strategies to deal with IRD and create a mobility training to these people go to rehabilitation and be more independent and have a more mobility. So
that's amazing, and that's really important. And certainly, the more all of us learn to deal with our inherited retinal disease, we certainly know there is a very mental effect to that, and the more that we can do as a patient community to help our patients get through this and to live and thrive as they are, even with an IRD, I think is incredibly important. Dr. Juliana, I also want to thank you again. You invited me down to Sao Paulo a year ago for Iscadur, and that was
Our pleasure.
It was an amazing event, and we were able to give the presentation of the patient point of view to the inherited retinal researchers that were there for that conference. And I think the patient perspective is becoming more and more prominent, which is what we need. I want to thank you both for all that you're doing for choroideremia, and both of you are from Sao Paulo, is that right?
Yes.
Yeah.
Ah, okay.
Yes, we are together.
Well, we hope you have a really good conference here at Arvo, and I hope to see you at our ICRN breakfast on Tuesday.
Okay,
Thank
see you.
you.
All right.
See you.
All right, ciao.